Good morning, everyone. I want to thank you so much for coming to our Food Policy for Breakfast seminar series. I want to welcome you to Hunter College here virtually in East Harlem. My name is Charles Plotkin, and I'm the director of the New York City Food Policy Center and a professor here at Hunter College. Today's event is in partnership and collaboration with the Center for Science in the Public Interest. We thank their staff for all the time and energy and for all they do to improve the food system and advocate for a better, healthier world. A few logistics for today. The program will be divided into 3 panels. Each will be approximately 30 minutes. And from behind the scenes, I'm going to keep the panels moving. And we'll finish it at 11 o'clock on the dot. We will not be taking any questions during the program. However, you can email us at any time during the program at info@nycfoodpolicy.org. That's info@nycfoodpolicy.org. And we will respond or get the appropriate panel expert to respond at some point. Today, we're honored to have an incredible moderator, Dr. Marion Nestle. Marion is fearless and relentless. She pushes food companies and policymakers to think and care about what, how, and where we eat. She has moxie. You know it the second you meet her. Dr. Marion Nestle is a true food and public health rock star. Please welcome today's moderator, Dr. Marion Nestle.
Thank you, Charles, for that introduction. I'm really happy to be here. This is a very, very important session. I think that reducing sugar is a critically important public health issue. And sugars have no nutrients but calories. They're empty calories. And there's an enormous amount of evidence that people who eat a lot of sugar are at higher risk for weight gain, chronic disease, and therefore poor outcomes from COVID-19. The most generous of current recommendations for upper limits on sugar say that they should be no more than 10% of calories. And that means for most people about 50 grams of sugar a day or about 10 teaspoons. But one 12-ounce sugary beverage has 40 grams of sugars, which is really close to the upper limit. And people in America report on average consuming about 70 grams a day, which is quite a bit higher. But I think that's an underestimation because the Department of Agriculture says that per capita availability of sugars in the American food supply is 120 pounds a year, and that works out to 150 grams a day per capita, and that's men, women, and little tiny babies. So we're eating a lot of sugar. And it's not very good for our health. A couple of points about it. Sugars are a big component of ultra-processed foods, the junk foods that are industrially produced and you can't buy their ingredients at supermarkets. And we know from Kevin Hall's work at NIH that there's something about ultra-processed foods that makes people eat more of them, take in more calories than they realize. Sugar is delicious and everybody loves it. And once you get used to a certain level of sugar, you want to eat more and more of it. And as Michael Moss says in his new book, Hooked, once we're hooked on sugar, we're really hooked on sugar. So there's a big problem here. And a lot of people are working on dealing with the problem of eating less sugar. And these are the people who are here on the front lines for these panels today. And to the extent that they can, I'd like them to talk about what they're doing to try to reduce sugar, what their relationship is to sugar reduction, but in very real terms, personal terms and political terms, what's really happening on the ground. So the first panel is about what's been done and what still needs to be done. I'm really happy to be able to hear what these people have to say. And I'm going to be calling on them one by one consecutively, starting with Nicola Davis, who's the Vice President and Chief Population Health Officer at New York City Health and Hospitals. And Nicola, I'd like you to start by explaining your role in the issue, but then go right into what my first question is. Your agency eliminated sugary drinks, yeah? How'd you pull that off? You must have had some pushback. How did you deal with it?
Sure. Thank you so much. Good morning, everyone. And thank you, Dr. Nestle. Thanks for the invitation to be here. Yeah, so I am the Chief Pop Health Officer at New York City Health and Hospitals, and I'm an internist by training, and I'm an obesity medicine specialist. So helping people to live their healthiest life is the motto of New York City Health and Hospitals, and it's what I've always wanted to do in my career. So a couple of years ago, we started an obesity work group in my role leading population health. We started an obesity work group and we brought together many people from across all of our facilities. Health and Hospitals has 11 acute facilities across New York City. We brought people across who I knew were really passionate about obesity. Within that work group, we started also an hospital environment and communications work group. And one of the goals of that work group was to reduce sugary beverages and to get it out of our hospitals. And we had a lot of different ways that we had to go about trying to do that. We did hit some pushback. What was interesting for us was that everyone in theory agreed that hospitals shouldn't sell sugary beverages. So in theory, everyone agreed, but there didn't seem to be that political will to really push it and get it out of our hospitals. So we really had to learn the persistence game. And this was about a 2-year process. There was some luck, some fortuitousness, because there was changes in the contracts that were happening with our food vendors. So we learned that we had to work with contracting, and there was about to be a change. And so we knew that we probably had a little narrow window in order to get it in the contract that sugary drinks would be out. And we also had to get our CEO on board. And that took a bit of work. And all of the physicians, many physicians signed a letter saying, we just can't talk to our patients upstairs about not drinking soda and then have them go downstairs and be able to buy soda. And we felt that there was really this disconnect. So we had physicians, we had nutritionists, we had public health people on our team, and we all worked together. We had a very convincing letter that went to the CEO. He signed off on it, and that really gave us the green light. So we were really excited that he was on board. So we learned that we had to go about it from different angles. Not everyone was bought in, but over time, and 2 years of work, we were finally able to get it done.
Well, that sounds absolutely miraculous, because hospital food is, it's almost a national joke. That hospital food is so terrible. It's junk food in the cafeteria and junk food for patients. And the big question that I have is, what do we have to do to make progress in this area? What are you doing on a wider area, going beyond just sugary beverages? And are you able to do anything? The fact that your CEO signed off on it seems miraculous to me.
Yeah, we've really been doing a lot in terms of changing the hospital food itself, the food that's served to the patients. I think just last year, they started a plant-based diet at Health and Hospitals. Yes. So it became an option for patients to be able to choose. And we really talked about how do we make it more of the default option so people might actually choose it as opposed to some of the other choices on the menu, so they could even be exposed to it. We have a plant-based clinic at one of our facilities where we have, patients with chronic diseases that are coming in and really learning how to eat a healthier diet that's grounded in, whole food, plant-based foods, as opposed to, processed plant-based foods.
Well, you're doing a great job. Let me, I'm sorry, we have to move on. But our next speaker is Elizabeth Solomon, who is Director of Nutrition Policy and Programs at the Department of Health. Same question for you. And then, how does your agency work to reduce sugar? Can you give us some idea of the scope of what you're doing and whether it's working or not and what you're up against?
Thank you so much, Dr. Nessel, for that question and for moderating today. And thanks for CSPI and Hunter College, New York City Food Policy Center for inviting me. I'm really honored to be here. At the health department, we really recognize that the root causes of health inequities involve systems of oppression, including racism and power imbalances. And those systems produce inequitable distribution of opportunities and resources for health, including access to healthy food. So the work in my unit and at the health department aims to shape the food environment, to make it easier for New Yorkers to eat more healthfully. And we try to build on the resources and knowledge and skills that New Yorkers have to make healthy choices and to eat the healthy foods that they want to be eating. So examples of that work include we're the technical advisors on the food standards, and the food standards were enacted through a mayoral executive order in 2008, and they are evidence-based nutrition criteria mandated for all city agencies to comply with in the foods that they serve, foods and beverages that they serve New Yorkers. The food standards impact New York City serves about 230 million meals each year that need to comply with the food standards. And so we've addressed sugar. The food standards address sugar in a variety of ways, including limiting sugary drinks through a calorie threshold and through specific standards that address sugar, such as in limiting sugar in yogurt, in snacks, in cereals. We also, through the health department, limited sugary drinks in all group childcare centers across the city through our health code. And we are the leads on the National Salt and Sugar Reduction Initiative, which is a national partnership of over 100 health organizations and authorities that have come together and called upon industry to reduce the sugar in their packaged foods and beverages. This is particularly, important for our public institutions and for consumers, because the idea is to reduce sugar in food products and beverages before they even reach grocery store shelves or before they even reach, our institutional kitchens. In addition to that, we have a long-standing history of public awareness campaigns and education addressing the harms of sugary drink consumption. And sugary drinks are the #1 contributor to added sugar in the diet. We also support community organizations in their work in trying to promote healthy beverage consumption and awareness campaigns. So we fund organizations to implement community-driven campaigns around the harms of sugary drink consumption. And we also partner with community organizations such as the Healthy Beverage Zone Initiative that is in the Bronx and works with work sites such as schools and businesses and organizations to promote healthy beverages.
Well, you're making it sound really easy. I'm curious to know, what kind of pushback are you getting? What are you up against in this?
I think that healthy eating is very challenging for New Yorkers. Not only the systems that I've talked about, but unhealthy food is ubiquitous. It's everywhere, and marketing is everywhere. Marketing for unhealthy foods and beverages, and particularly, communities of color are really targeted. And so, I think we are up against, big, powerful systems that shape the environment, and a lot of money is spent on advertising. The Rudd Center, put out a report in 2018 that the most advertising money in going to Black and Spanish TV or was for fast food and restaurants, and the least was for healthy, foods and beverages like water and fruit. So it is not easy work by any means.
Well, it's fabulous that you're doing it. Our next speaker is Pam Cook, who's the executive director of the Lori Tisch Center for Food Education and Policy at Columbia, right? Columbia Teachers College, that's where you are, right up the street from me. You're doing a lot of work in schools, and I guess my question is, why is it so difficult to get the sugar out of schools? But introduce yourself first.
Sure. Yeah. And then, well, thank you, Dr. Nessel, and thank you to CSPI and to the Hunter Food Policy Center for having this. And as with all the panelists, I'm delighted to be here. First, you know what, I want to start with the real challenge. And this goes back to Dr. Nessel, what you said, that you think that the 70 grams of sugar a day is an underestimate. I completely agree from working with our youth in upper elementary and middle school in New York City, especially because of what Liz talked about, the racism and power imbalances. And in many of our communities, it's just normal on the way to school to grab a 20-ounce beverage, which is about 65 grams of sugar when they go in, probably with some kind of snack food that has sugar with that too. Same thing after school. And that's the out of school community. So just think of the grams of sugar that's adding up to, and that's the environment that we have set up for our youth, and particularly our youth in communities that already have a lot of health disparities. And what we've done then in education is really help them to try to understand this power imbalance. And what they end up finding is they have this recognized tension. They want to take care of themselves. They want to be good at whatever they want to be good at: school, sports, dancing, writing poem, whatever it is they want to be good at. They want to be good at that. And then they realize they're making food choices in an environment that's making it impossible for them to be their best selves. And they get angry about that. And so from doing that, and I can share a lot of stories, but basically maybe one story is one student that we worked with said, you know, I understand all of this. I want to make healthy choices, and I know what I want to do. I want to eat fruits and vegetables. I want to not have sweetened beverages. My family has really few resources for food. I have an aunt who works at McDonald's, and we're lucky when she gets to bring home leftovers. That's what we eat. So that's the environment that we have set up for our youth. And we want them to understand that environment, to get engaged so that they can be part of those community actions that Liz was talking about, that we make those changes. So we want to have change both in the school environment, which I'll get to in a second, as well as outside the school environment, which is why the National Initiative for Reducing Sugar and Salt in Our Food. And I'm also president of the Society for Nutrition Education and Behavior. That's an active member in that group. And so we want to make sure that we are setting up the right environment, because nutrition education can't work if the environment is so incredibly toxic. And so we want to make our jobs as a nutrition educators that we can help people understand the environment, navigate through it, but not impossible that they can't make those choices. So why has it been so hard to get sugar out of schools? First, schools out, but we have a lot harder time with because we have a capitalistic society and people can make money. It's really hard to control outside of institutional food what happens. It's also hard to control it inside of institutional food as well, because even though there are meal standards, schools have to be serving food that the kids are going to take, because participation is what brings in the money for that. And so if we take chocolate milk as an example, that may make the kids take the meal. And even though the chocolate milk in school meals is less sugar than if they were to buy like a name brand of chocolate milk outside of school, it still is a lot of sugar. Yet you have to get the kids to take the meal. Ultimately, school meals are healthier than the rest of the food environment, only because the rest of the food environment is so incredibly toxic nutritionally. So that's the challenge that we're up against.
Yeah, I mean, my experience with school meals is that whether the kids take the meals is completely up to the adults in the school. If the adults care about what the kids eat, the kids eat. If the adults don't care, they don't. So what are you trying to do to change that environment, or are you? Or
No, we are.
Where are you in that?
Yeah, no, thank you for asking that. I completely agree. And if some of my colleagues, especially that have spent a lot of time in school cafeterias, when we have looked at consumption, which by the way, just getting the kids to take the meal is the first step. Getting them to eat the meal is the second step. And that is really important. And schools vary in that tremendously because of exactly what you just said, what kind of environment they are setting up. And the DOE is doing a lot to try to support that too. I think actually with COVID and meals in schools happening in different ways in the classroom, and then kids coming back to the cafeteria, we have an opportunity to remake school lunch. And I hope that we can remake school lunch post-COVID because one, we realize kids need a nutritious meal in the middle of the school day to be able to do well. And that has been increased in importance. So two things. One, there has been for middle and high schools, a lot of money put into cafeteria redesigns that is making it a choice-based line for students, and then also have really nice tables and a variety of table settings. We did research on that, and it actually showed participation went up. Fruit and vegetable consumption went up in one school, but not overall in the 3 schools that we looked at, because that school basically put out a lot of salads that had a lot of vegetables in it with chicken and pita or tortilla to be the grain. So it was a whole meal. Other schools ended up putting out a lot of, which meets the standards, a lot of pizza and fries and chicken tenders and fries. And then that's what the kids ate. So, and the salad bar, the location of the salad bar makes a huge difference. So just getting that in a place that it's part of the line that kids can take it makes a huge difference. We also, in the year before the pandemic, 18-19 school year, 2 kitchens in the Bronx actually went to a full scratch cook menu, which was less processed food overall. And that was supposed to grow. With COVID, it's going to be hard to do that. Those 2 kitchens and their grab and go meals are still doing a full scratch menu. It shows that it's possible to happen, and we need to be advocating for that. So once again, what I really hope is post-COVID, we can make school meals, and the essential part of all kids eating a good meal and having a good meal experience during the middle of the school day is critical. And so that's what we want to do, and increase scratch cooking because that lowered the processed foods, and increase things in schools where everybody in the school is caring about school meals to create a great environment for the students. So they both take lunch as well as eat what they take.
Well, that's a bravo for that. And of course, the COVID pandemic has raised a possibility that I would never have dreamed possible, which is of universal school meals. We have them for a while. Let's make them permanent. I have a question for the whole panel, and it has to do with food and nutrition standards. I'm worried about nutrition standards because they seem so gameable. You want to comment on that, starting with Nicola, you want to comment on the whole question of standards and their gameability, and whether we could switch to food standards and say fruits, vegetables, and not worry, and no processed foods or ultra processed foods, rather than dealing with nutrition standards? I don't know, it's a thought.
Yeah, I mean, I think one of the things we've tried to do is just adhere to the standards that have been put out by New York City, and to have them actually be embraced and utilized in our, in our hospitals and in our meetings and things like that. So I think having standards are good. I think it's kind of a first step, but I do agree. People try to find ways around actually meeting the standards, and what foods can you put in that kind of meet the standards that you can get away with. And I think sometimes we just have to kind of get back to basics. And it is fruits, vegetables, and unprocessed foods. Like as much as we can get away from processed foods is better, and it keeps it simple. I laugh when I see some of the foods that people eat that they think are healthier, and I'm just like, well, I'm not sure that I would call that healthier necessarily. It's a different choice, but I don't think it's necessarily healthier. So I think we've just made things way too complicated that when people are even trying, they're not sure what's healthy and what's not. And so I think the simpler we can make things, the simpler we can make the standards, the easier it will be, and it's harder for people to game those things.
No, I'm so glad you're in that job. Liz, you want to comment on that?
Sure, and thank you for that question. I agree with everything Nicola has shared, and I will also mention that in the food standards we do promote whole foods. So there is promotion of using fruits, vegetables, whole grains, and we do recommend phasing out processed meats. So that is there. In addition to, we promote whole foods in all of our other programming, I would say, in my unit, from our nutrition incentive programs that promote fruits and vegetables and beans to our education. So we are in alignment. I also will mention that we are in the middle. The food standards do get updated every 3 years. So we're in the middle of a revision right now.
Oh.
And in those revisions, we look at current research, we look at federal recommendations, and we talk to our city agencies and about feasibility, and we take all of that into consideration. So hopefully, I am hopeful that we'll be releasing updated food standards later this year.
No, I'm glad you're in that job, Pam.
Sorry, it took me a second to unmute there. I am glad both of you are in your jobs too. And I want to say every one of my degrees is in nutrition, and I am 100% for food standards, because if you have nutrient-based standards, basically you can have formulated foods that are meeting those nutrient standards without actually being healthy foods. We know enough about, from Kevin Hall's study, as well as other research on ultra-processed foods, that is what's in ultra processed foods that are ingredients that make food hyper palatable, which is also affecting all of but particularly children's taste buds to be able to actually develop a palate for food. So we need things to be basic foods in order for people to be able to eat well. That actually relates to one of the things in our new 10-year food plan for New York City, which hopefully other cities around the country will follow. One of the tactics is to actually have freshly prepared meals, which is the scratch cooking going forward. And that is using basically a foods-based menu. It's actually harder for the USDA food school meal standards to do scratch cooking and show that you're meeting the standards, which is kind of silly and ridiculous. So we need standards that actually make it, when you're actually cooking real meals, the kinds of meals we want kids to be eating, to actually be easier to show that you are following the standards instead of harder. I want to go back to Dr. Nessel, the last thing that you said about universal free meals. I am all for universal free meals. Very often we have debates for government programs, whether we want them targeted to those who need it or universal. There is so much research with school meals that when they are universal, you take away the stigma, you make it part of the school day, that it is worth having it apply to everyone. And actually, even though universal meals have been extended through next school year, there's also some talk that districts that already had universal free meals through the community eligibility provision would have to reapply in the next school year, which would actually might reduce it even more after that. So we want to make sure that this COVID-related response does become permanent on a nationwide basis, and keep working towards that.
Wouldn't that be nice? Okay, one last question. What do we do about food marketing?
We just have about 1 minute left.
You get 20 seconds each. Nicola.
Wow, that's a tough question in 20 seconds.
Are you thinking about it?
Lobby against the food marketing.
Liz?
The city 10-year food plan that Pam mentioned does state a committed effort from the city to look at ways to reduce the prevalence of unhealthy food and marketing of unhealthy food, and to look at our own policies and identify opportunities to reduce promotion and marketing of unhealthy foods. So we'll be exploring that area.
Right. Pam, the last word.
I think what we just have to do is keep advocating to put public health first, because if public health is front and center, that's how we can advocate for, we absolutely need reduced marketing. Marketing works, which is why they do it. So it needs to be reduced.
Marketing works. That's why they do it. Absolutely. Thank you very much. This was really fun and informative. And we'll move on to the second panel, which is about pouring rights, contracts in public universities. If you don't know what a pouring rights contract is, it's a contract between a soda company, usually Coke or Pepsi, with a university for exclusive or semi-exclusive use of their products on the campus. So New York University, my university, is a Coca-Cola campus. And the way this works is that the companies give millions and millions of dollars to the universities for exclusive rights to their products or semi-exclusive rights, and they must feel like they're going to make that money back in sales. And what this does is put the university, in my view, it puts the universities in the role of pushing those drinks, because the more of them they sell, the more money they get. And that's a conflict of interest that makes me very uncomfortable. The main argument is that the kids are going to drink them anyway, and the universities might as well get the money. I see a moral hazard here, and I know I'm not the only one. So our first panelist here is Jen Falvey, who's an assistant professor of nutrition and human development at UC Davis. Hi, Jen. It's been a long time since you were a student and you and I wrote a book chapter together, but welcome.
Hi, Marion. It's so nice to see you. So I'm a professor at UC Davis, and my research focuses on policies and environmental approaches to make the healthy choice the easy choice. And my work has focused on healthy retail programs that transform corner stores in low-income neighborhoods into healthier retailers. My work has also looked at policies to reduce sugary drink consumption, including taxation and warning labels, which have been very effective, not only at reducing consumption, but also taxation in particular has been important for raising revenues to fund public health and health equity programs. And more recently, my work has shifted over to the university environment. I'm the faculty lead for this UC-wide Healthy Beverage initiative, and I'm the faculty lead at the UC Davis campus. And this initiative is focused on installing water stations to make tap water more available, but also creating environments where sugary drinks are not front and center. And what's interesting is seeing how pouring rights contracts can interfere with initiatives like the Healthy Beverage initiative. I was really stunned to find that some contracts require that sugary drinks are available everywhere on campus that beverages are sold, which really can interfere with this evidence-based approaches to reducing sugary drink consumption and promoting health. And so my research has actually focused on pouring rights contracts. I have interviewed more than 64 university officials across 32 universities in the country in different regions. And the interviews have been with stakeholders from dining, health promotions, contracts, and athletics to really understand what is the on-the-ground impact of these contracts, and how do the stakeholders view the pros and the cons of the contracts. Furthermore, my research has also looked at what types of beverages are available at universities across the country, and we're finding that about 70% of the available beverages are sugar sweetened. And just to put that into context, a 20-ounce bottle of soda will have more sugar than the entire daily amount that is recommended as a limit. And what we're finding from our stakeholders is that these contracts have increased the availability of sugary drinks on campuses, whether it's because the product mix that's available to purchase is skewed towards sugary drinks, or because there's a minimum number of required vending machines across campus. They lead to the placement of beverages that are sugary at prime placement, at eye level. There are pricing incentives, as Marian alluded to, for universities to sell more of these, and promotion. So there's signage on scoreboards for promoting sugary drink brands. It's on the vending machine wraps, it's on the dispenser wraps, it's on cups, it's on swag. There's taste testing and marketing that occurs with the student body, even digital marketing. So some of the contracts will require social media marketing, marketing on the university websites, and on video games even. And I think what has surprised me the most is the chilling effect that the contracts appear to have on health promotion and water placement at universities. I've had dining directors tell me that they have been told to take down sugar education signage that was placed near sugary drink dispensers. I've been told that they've been asked to remove spa water or tap water dispensers further away from sugary drink dispensers to not compete with those beverages. So, you know, I think there are some concerns with the current way these contracts have been implemented on campuses.
It's impossible to talk about these issues without talking about food justice and equity issues. Where are you in that discussion? How do pouring rights fit into that?
Yeah, that's a great question. As the previous speakers have mentioned, you know, communities of color and low-income communities have been disproportionately exposed to marketing for sugary drinks. And in many communities, there's a lack of choice around healthy beverages and healthy foods, almost like this food swamp type of environment. And what we don't want to see is that kind of environment on college campuses. But unfortunately, in some cases, we are seeing that in stores. So I think that that's a really good point. We want to create healthier environments for our students, staff, and community. And then, you know, there's also a desire from many students that I've spoken to be able to promote and purchase beverages from local businesses, businesses that are women-owned, owned by people of color. And these contracts end up locking out a lot of local producers that could be providing innovative beverages that meet the needs of students. And then I think a third point is that at some universities, dining directors have told me that these contracts lead to pretty high wholesale prices for them. So to the point where they could, you know, go to Costco and actually purchase beverages at a lower price than the wholesale price negotiated in the contracts. And that leads to higher prices that students would pay in the retail environment on campus, including for healthier beverages like water. So in a way, I've been told that this is cost shifting, right? The money has to come from somewhere. And when wholesale prices are higher, then students end up paying for that. So that is another issue of justice and fairness.
Great, thank you very much for that. Our next speaker is Richard Black, who's principal at Quadrant D and a former vice president of Global Nutrition Sciences at PepsiCo. I'm really interested to know whether Quadrant D, I don't know what Quadrant D is, and so, you know, you'll tell us what that is, and maybe tell us what you did at PepsiCo, and maybe you could tell us if you think that there's some way that soft drink companies can be part of the solution to the sugar problem.
Thanks very much, Marian. And I'll say thanks to CSPI as well and Hunter College Food Policy Center for the invitation. I have taken so many notes when everybody's speaking. There's some phenomenal things that people have said so far. My background, I've been in the food industry for about 25 years. The last 13 or so was, I was Chief Nutrition Officer at Kraft Foods Mondelez, and then I went to PepsiCo. I was Chief Nutrition Officer there as well. Been consulting, which is what Quadrant D is, for about 5 years, adjunct professor at Tufts University and adjunct in the School of Nutrition Sciences and Policy, and adjunct professor at McGill University in their School of Business. So I consult with a bunch of people, nonprofits like the Gates Foundation and Pulse Canada and things like that, but also companies. worked on this issue a lot. And Marion, the question you said, how do you get the food industry to really be a positive partner in this? I think it's possible. The first thing, though, is you have to understand the incentives that the purchasing people within the university are working with. And it doesn't matter what you do on the industry side if we don't simultaneously look at, well, what's driving these decisions within the university. So Dr. Falvey was talking about higher wholesale costs, probably because there's a back end thing. You hit a certain target of volume and the company gives you a big, oh, congratulations, here's your bonus, right? And so the university is actually driving for more volume because of the way they are incentivized internally. Is that fair? And Jen, Dr. Falvey's nodding her head, yeah. So yeah, and I've seen that absolutely mess up a cashew business because of conflicting, I mean, it's saying it's unrelated, but conflicting targets, conflicting incentives can really undermine any efforts. But it's possible to use marketing in the other direction. And the example I'll give is, it's a PepsiCo example before I came to the company. If you go to the UK, at least I can't say it is now. It was up until at least 2 years ago. You won't find full sugar Pepsi advertised in the UK. And the decision was taken by PepsiCo that, you know what, we're a low second player or third player on the sugar sweetened beverages side. We can sell our zero sugar products and low sugar products more effectively if we take all that budget and focus it on that. So in fact, the biggest selling product I think is called Pepsi Max, which is a zero sugar product. And the company took that decision. So when you apply that then to pouring contracts, and you've talked a lot about the different push pulls in the pouring contracts, and they are critical for an income source. It doesn't have to be the case that sugar sweetened beverages occupies like 70%. I was dumbfounded when Dr. Falvey said that, occupy such a large percentage. You can imagine, just as a number of countries have tried to do, is shifting that balance over time and incentivizing the company and giving the pouring contracts to the company that does so. And it was mentioned earlier, I can't remember by whom, maybe it was Pam Koch, about this unique opportunity as the contracts shift. As one contract wears out or finishes up, I beg your pardon, and another one starting to come into play. That's when the opportunity comes to begin the negotiations anew, in my view, that you can, the company isn't interested in selling sugar. The company is interested in selling beverages and making a profit off of beverages. And so it's shifting that perspective. You can't make it happen all at once. There'll be all kinds of pushback. But there are, I think, a number of ways to demand, in fact, I would argue, that the companies aid the schools in making that shift and pushing that forward. And you can imagine that end of year bonus, if you want, the dynamics of that can be changed too, so that you get a far higher bonus, if you want, for the low sugar-free products, and a diminished bonus for those that contain sugar. And then that even over time goes down as the other goes up. There's a lot of different ways you can tackle this. And as I say, in my view.
Yeah, so it sounds like that the partnership is a little bit more complicated than just simply money, that they're both sides involved in this. So the question is, how do the schools get the money and how does the company get the money? Somehow public health tends to get lost in the middle of all of this.
Yeah, I think that the challenge is that from a public health perspective, we're often, which I've worked in this space so much, you're often going in there with that message of health and the longer term benefits. And you're up against the business people who are very much focused on the near end business case. And so you really need to, at the very outset of your targeting, whatever the opportunity might be, pull in those business people, understand what their incentives are, find out how you work within that context to have them be your champion for the change, as opposed to the obstruction for the change.
Okay, advocates, you know what you need to do. Let's move on to the last speaker, who's Kelly Garvey, who's a recent graduate of the University of California, Santa Barbara. Kelly, you want to tell us what you graduated in and how you got involved in the sugar issue and what you're doing now?
Yeah, I'd love to talk about that. Thank you so much, Dr. Nessel and the Hunter College Food Policy Center and also CSPI for inviting me to speak. I'm part of this incredible panel of public health and nutrition champions. It's really an honor. And so speaking on my involvement, research, and experience at UCSB, I graduated last June 2020 with degrees in anthropology, environmental studies, with a certificate in medical humanities. I'll be attending Stanford in the fall for a Master's of Science in Community Health and Prevention Research, as a goal to improve public health on a community scale, because I'm really passionate about that. That's really what I focused my thesis on. And so during this gap year, I've been a research assistant for the Healthy Beverage Initiative, which Dr. Jen said is a UC-wide initiative to reduce consumption of sugar-sweetened beverages, but also increase the availability and consumption of tap water on campus. It's a really big part of the initiative, actually, because what we found, like she mentioned, is that water is not easily available for students, and that's why they often default to buying beverages. So the research group I'm a part of is led by Dr. David Cleveland, who I'm very thankful is on this call. And we've been conducting a life cycle assessment of the beverages sold on campus to assess the climate, plastic, and blue water impacts of our beverage environment, which I think is a really important part to speak on, as we know all of these impacts of SSBs in terms of health, but the environmental impact of all bottled beverages really needs to be stated, and that everyone who chooses to buy a bottled beverage is contributing to a large issue of plastic pollution, greenhouse gases, and blue water, along with like many other impacts associated with what it takes to process and produce beverages, any beverages, not just sugar sweetened beverages. And so our research is going to be able to allow us to extrapolate how much the UC system and any university could really reduce their environmental impact if we actually remove or improve current pouring rights contracts. And so as a research assistant, we're also designing discussions, building our working groups, collaborating with the campus stakeholders, because the biggest thing that we're kind of working on right now is that whoever made this decision to enter a pouring rights contract didn't involve all campus stakeholders. And that's pretty unethical, because we as students who are the backbone of universities need to be involved and need to have input in these large administrative decisions that affect us all. And that's the thing, is students don't understand that a lot of these kind of backdoor decisions have really impacted the health and environmental like what we feel on campus. And so that's what we've been working on, and I've just been really privileged to be able to be a part of this really groundbreaking work, because as a top public research university at UCSB, we have an opportunity to trailblaze and actually make a difference in changing and being on the right side of this, and not settling for multinational companies to buying us out and using us for branding and marketing, but actually bringing in, like Dr. Jen said, actually local businesses and our community that we want to support, and not just being a face for marketing that pouring rights contracts pretty much make us.
Yeah, I'm really impressed that you're involved in this kind of thing. I was a student at Berkeley in the 60s, and when there was a lot of student movement activity, and I don't see a lot of student movement activity. What are you doing about trying to mobilize students around some of these or any other issue? What's your sense of what students are like these days?
Yeah, so it's been interesting, I gotta say, over Zoom. I mean, everyone hasn't been on campus this last year, but I think that's where we're really finding an avenue to create a beverage environment when we get back there, and it be one that's improved and what students actually want, because the current beverage environment we have now is not what students want. It's not what students decided. It's not what most of the campus stakeholders decided in terms of staff or faculty. It was made back in 2014, and so it's kind of a while ago. We can't blame those people for not realizing, like, it's kind of not a great thing to enter in terms of ethics, and why we should promote more local and partner with communities to sell beverages that students actually want, and all staff and faculty. But it's interesting because our university, so we have a huge environmental studies program. It's like over 50 years old. We just celebrated the anniversary this last year. A lot of us are very passionate about reducing our own environmental impact and being very conscious about that. And when it comes to talking about these pouring rights contracts, replacing SSBs with non-SSBs like bottled water or just like even like juice that has like no added sugar in it is really not the option. The option is to improve tap water accessibility and actually make it accessible for people to not have to choose like, oh, I literally have to go walk across all the way across campus to get a water, like fill up my water bottle, when I could just like go to the Arbor, which is our corner store, and just buy a bottle. Like we are trying to shift our beverage environment to be a healthier option rather than just stay in these contracts and be like, yeah, we can improve it. Because if you replace an SSB with a non-SSB, you still have all of the climate, greenhouse gas, blue water, we have all of that pollution still. So in terms of long term, if we want to advocate for the health of not just like people, but the environment, we need to assess what these contracts are actually producing on our campus. And that's millions and millions of pounds of CO2, tons of plastic pollution, because we're also partnering with Pepsi and other universities, Coca-Cola. Those are the top plastic polluters in the world. And that is what we're basically like telling is like, yeah, we're fine with partnering with these really toxic multinational companies just to get $6 million at the end of the year. So in other universities, I know it's a bit harder because they are so much more supportive in terms of athletics, huge sponsoring. I mean, what company wouldn't want their name on the backs of these like all-star players getting drafted to the NFL, things like that. So there's large incentives for that, but then also you're selling out students and you're basically telling them if you're going to wear this brand and you have no choice in it. So there's a lot of ethical issues, environmental issues, and on top of just the health impacts of what these contracts produce.
Yeah, thanks for that. As I said, moral hazard. One thing that makes me curious is what happens with the revenues. Is there some way at least to make the revenues useful? When I first started writing about pouring rights contracts, and I had an article that came out in 2000, 21 years ago. Most of the money went for sports equipment. Is that still the case? And what should be done with those revenues starting? Jen, you want to comment on that? And this is a question for all three of you.
Yeah, it's a great question. It varies by campus, but yes, athletics is still a large recipient of revenues, but there also might be revenues for student groups or the student union or housing or dining to some extent, but still athletics tends to be one of the largest recipients. And I think with respect to the overall amount of money that's brought in, at many of the UCs, it's a fraction of a percent of the operating budget. And a professor who has a large federal grant will bring in more money potentially from one grant than the entire amount of money brought in from the contract. So although they do bring in money, there are it's perhaps less money than is perceived. And I think there's also this issue of cost shifting. On the one hand, we have, business development folks who are responsible for bringing in this external money, but we have university HR, which is responsible for health insurance costs. And we have pensions for staff and faculty that need to be solvent. So the cost of chronic disease like type 2 diabetes is really taking a toll on university budgets. And so really thinking about the long-term costs of contracts like this is something that needs to be thought about. And I think Richard was alluding to this earlier, that you've got different entities within an organization that's making the decision on the contracts versus the entities that have to actually deal with costs from chronic diseases. So one solution I want to propose is that that students and faculty, especially who have expertise on this issue, be involved in the process of whether or not to renew these contracts. And if they are renewed, how should the RFP be written? How should the contract be written in a way that promotes health?
Ah, yes, the externalized costs. Richard, you want to comment on that?
Yeah, I'm just going to add to what Dr. Falvey said. When Jen was referring to the different entities within the university, this is true. I've seen it in so many different places where you think you've got to solve for this, and it makes perfect sense. but the budgets and the incentives around those budgets are so siloed one from the other that saving in the food side only impacts, I mean, reduced income, perhaps. Let's assume it's just a little bit of reduced income in the food side. It negatively impacts the food side. And they don't see in their own incentive structure the benefit of that healthcare cost saving that benefits the university as a whole. And those people over there aren't kind of think, well, they'll say, well, there's so many different, and I've had these conversations, so many different things going on. We can't point to one thing and say it's that. So we don't know what we can attribute back to this particular aspect of what you've done. No, you can model that by 9 ways to Sunday and come up with a decent estimate. So it's really getting those people to talk, I think, that's going to be critical. We can't do this by ourselves in the public health space. You really need to understand the underlying incentives. Along that, you mentioned, Jen mentioned student groups. A tiny $10,000 amount of contribution within the context of large grants, it's nothing. But to a student group,
It's a lot.
holy cow. And so there's this false, I would argue, false sense that these things are critical to student groups. No, it's the way in which the budgets within the university as a whole are structured that make it appear that way. Yeah.
So a much larger issue and a more complicated issue in a way. Kelly, do you want to comment on the revenue issue?
Yeah, definitely. It is what we see in our pouring rights contract at UCSB and a lot of them elsewhere that we've heard from CSPI is that these companies basically like donate all the merchandise and everything and make it seem like, oh, they're like giving so much to the university, but it's basically like they're paying themselves to be marketers. So it's a really interesting way how they frame these like donations when it's really just not even contributing actually anything to student life or like student health on campus. And so like just chiming in what both previous panelists just said, the long-term health impacts that you could reduce is incredible. And we don't even know in the long run exactly like how much it could be. But on top of that, just the environmental impact, being able to actually support more local companies and not have Pepsi just monopolize this space would be a really great opportunity for our communities to actually thrive and put more revenue back into them. Because I think it's interesting when you think about, America is the land of choice. And when you look at shelf space anywhere across the UC or any university, like 70–80% of it is one company. But don't we as Americans kind of value this idea of being able to choose whatever we want? Because what falls under Pepsi is all of these names that we think are different brands, and they're not. And what at UCSB in our campus discussions we've had like every single quarter is we found that people really want to actually know that there's many companies on campus able to sell their beverages and not just be kind of like taken over or marginalized by these larger companies that have just been rooted in our food systems for such a long time. But in terms of the revenue and just how much it costs to campus, and it really is an issue of really reevaluating the budget and moving money around, because people always say, that's obviously the number one argument is, oh, but if we get out of these pouring rights contracts, what about the revenue? What's your, like, you have to decide, or you have to figure out like what the financial compensation is going to look like, where is it going to come from? And we've talked on our campus about philanthropic buyouts. How great would it be for alumni to actually sponsor students and things like that, instead of multinational companies like putting their brand on the back of their t-shirts, things like that. It really is a question of the administration wanting to be on the right side of moving forward and being able to promote the initiatives that they set forward for the whole UC and just across any university, and actually align them with these contracts that we're getting into, and really doing a vetting, like saying like, how can our UC-wide Healthy Beverage Initiative actually coincide with this pouring rights contract on top of this UC phasing out of single-use plastic ban? How are these all moving together, and how are these even working? Because it doesn't make any sense. There's no one actually vetting through all of these initiatives. How can this work? And then
Kelly, I want to squeeze in one more question if I can.
We have about a minute left. Sorry.
A 20-second answer to this question. What should health advocates and environmental advocates be doing about pouring rights contracts? You get 20 seconds each.
I'll go first and let the others think about it really quickly. understand the incentives driving the choice. Don't assume it's all about health. And that's the mistake we all make, I think. I do it too.
Thank you for that. Jen?
I think getting, being familiar with what's in the contract. They can, request, Muckrock has contracts online. Contracts can be requested through Freedom of Information requests within state law. So that just, that first step and just getting the word out there of what is in the contract and the nature of the contracts.
Good point. I think people would be shocked. Kelly?
Yeah, I think what we all can do is just make sure that this topic is brought up often and brought up consistently and brought up in a lot of larger contexts, because it's not just about telling people not to stop drinking sugar. It's that to really evaluate these larger issues in the food system. And we can all be a part of that and actually take initiative and really spread the word. And that's what's going to make change.
Well, thank you, all the three of you, for really thoughtful comments about what is really a very complicated issue. It sounds like it's simple, but it's when this much money is involved, even if it's not in the context of the larger university budget, it makes it a very complicated issue. And thank you, all of you, for your thoughtful comments. Our third panel is about sugar warnings at restaurants. Here's another really tricky topic, because the restaurants, if they're not chain restaurants, they're making menus up every day. It's really difficult to do nutritional analyses. They're not measuring the ingredients that they're putting into their foods. So what we're really talking about is chain restaurants that have formulas for their products. And that's, we have calorie labeling nationally for these. New York City has salt warnings, and then there are warning labels on processed foods in a lot of Latin American countries now, a very interesting trend that's been taking place. So should we be doing this too? Should we be having warning labels in restaurants and I'd like to add food packages to that. And we have three panelists who are going to be discussing this. Our first panelist is Julio Salcedo, who is a representative for Teens for Food Justice. He's an intern there and is a student at Lehman College. So Julio, why don't you start by telling us who you are and what you're doing? What's Teens for Food Justice? And where are you on the whole sugar warning label issue?
Yeah, thank you so much. So hi, everybody, and good morning. My name is Julio Salcedo. I'm a first-generation Latino college student. I immigrated from the Dominican Republic, and right now I'm studying nutrition, dietitian, food science, and psychology at Lehman College. So first of all, when I was a kid, I always wanted to help others. So I decided to be a doctor, but I just noticed that there are different ways to help others. And one of those ways is teaching, educating, giving awareness, information to people to benefit them. And that's how I was like really interested in teaching and being an educator. Then when I was growing up, I was really interested and fascinated about those topics about food justice, mental health, and activism. And that's why I was like so inspired about it that I decided to get more experience about food justice. And then I get to this two amazing experiences, which are both interested. The first one is food justice, CUNY Food Justice Fellowship, and then I get to the Teams for Food Justice internship. So they are both amazing experience, and I learned a lot from both about food justice and nutrition. Then about the added sugar topic, I was really concerned about my community. My community as a college student and as an immigrant, and also as a New Yorker from the Bronx. I understand that people, every time I go to the supermarket, I don't see people reading the labels or noticing that added sugar is on this recipe, on this product. So people don't usually, I mean, based on my experience, people don't usually read the labels. And then I noticed this on my community and I was really concerned. And people doesn't understand it's not only I eat because I eat. It's also that everything that I eat has a consequence. And that's why I understand what studying nutrition, that this food can have a consequence in my body. Any food, any product, any recipe has a meaning to my body. And that's why I want to give awareness to people about what is added sugar, what can cause. Because let's be honest, there's another pandemic, and it's not COVID-19, it's obesity, it's chronic diseases, it's diet illnesses. And people need this awareness. So that's why we need levels. That's why we need awareness for people to understand that everything has a consequence, and even it's a good or bad consequence, but we need to have this awareness available for everybody. So that's why I was really interested in the topic about added sugar, because I want my community to relate, to know that these topics are to be considered for our kids, for our future, for ourselves, our families. Because I have family members who have suffered from diabetes, low blood pressure, from obesity, and I think we need this awareness before we can prevent a bad consequence. So yeah, that's why I'm really interested on the added sugar topic.
You're a student at Lehman College. Is there much education about the role of sugar? Are you seeing any education in the community? Where's the gap here?
Yeah, for me, the gap is that we're not actually putting more effort about educating people. I mean, on Lehman College, we have classes and courses that actually are free for everybody, but I don't see like this going in communities of low income communities, people of color, and even here in the Bronx, there's a difference because you see a lot of these courses outside in Manhattan and every other borough, but you don't see it in the Bronx. And I think it's important for people to have this information, and I think that we need this in all places, in all communities, and be I don't know, advertise these nutrition facts so that people have more concern about what they're eating.
Good. Thank you very much for that. Our next speaker is Aviva Musicus. Am I pronouncing that right?
Yes.
Oh, good. Oh, good. Who's a postdoctoral research fellow at the Harvard T.H. Chan School of Public Health. Tell us about that. Tell us what you're doing. Your own work has shown that sodium warning labels are useful. How'd that work? And will this work for sugars? Let's start there. So lots of things to do.
Thank you. Thank you so much for having me. I'm honored to be here. So my research builds evidence for policies that can reduce or prevent chronic disease. And as you said, a lot of my work focuses on evaluating food labeling, both on packaged foods and on restaurant menus. My menu labeling work has largely focused on the effects of sodium warning labels, which are required on restaurant menus in New York City and in Philadelphia right now. You may have seen them if you live in either of those cities. And I'm currently working with Dr. Jen Falby, who just spoke earlier, to evaluate the effects of added sugar warnings on restaurant menus. And this type of policy is really important because we know, as this panel has discussed, Americans eat way too much added sugar. It causes health problems, but there's growing awareness around it. We know that packaged foods and drinks are now required to display added sugar content on the nutrition facts panel, but there's no type of added sugar disclosure required at restaurants. And that's problematic because people in the US eat at restaurants or eat from restaurant foods quite often. Restaurants provide nearly a fifth of daily calories for kids in the US and a quarter of daily calories for adults. And we also know that the food that people are buying at restaurants tend to be less healthy and in bigger portion sizes than they normally would eat if they were just cooking food for themselves at home. And we also know that Americans generally are unaware of how much added sugar is in restaurant foods and beverages. And I think they would be very surprised to learn how high in sugar a lot of these foods that they're ordering are. So based on previous research that I've done on sodium warning labels and also based on calorie labeling research, I think we could expect that added sugar warnings would have two main effects. So one effect is that it could help people make healthier choices at restaurants by educating people about what's in their food And also by increasing the salience of health risks right at the point of purchase. So right when you're going to order food, you remember, oh, that has a lot of added sugar, I'm going to choose something else. But the other effect is that it can help nudge restaurants to reformulate menu items that have more than a day's worth of added sugar. And reformulation is a really useful outcome because it doesn't require any behavior change on the part of the consumer. So everyone who goes to these restaurants will be offered foods that are lower in added sugar. So I think everyone wins in that case.
So are you seeing any surprises in this? Where's the sugar hidden in restaurant foods where people wouldn't expect it to? I mean, everybody would know that a dessert would have sugar.
Yeah. So all of the, basically all the desserts at full service chain restaurants are high in added sugar. They have more than a day's worth. A lot of drinks, so sodas, sweet teas, lemonades, smoothies. But I think the most surprising is that a number of salads at full service restaurants have more than a day's worth of added sugar, which is terrible. It's completely unnecessary. And I think it's because they come with sugary dressings that are served in really high portion sizes. But I think people would be really upset to learn that, especially because I think people choose salads because they're trying to make a healthier choice. The other area that, or the other menu items that have a lot of added sugar is basically anything with barbecue sauces or glazes.
Oh.
So things that say like they're slathered in honey barbecue sauce, that kind of thing. So ribs, chicken wings, that kind of thing.
And where are you running into barriers on this?
Well, from a research perspective, we can study a lot of different things, which is nice. And what we've done so far is we've pilot tested different designs for warning labels. So on a menu, there isn't a lot of real estate for warnings, but you can either have an icon or an icon and text. And our preliminary results show that icons work just as well as icons and text. And that's nice because icons are helpful for people, especially for people whose first language is not English. It doesn't rely on that text. And they can appear on menus next to icons indicating other nutrients of concern. So you can have an added sugar warning label next to a sodium warning label on restaurant menus in New York City, for instance.
Great, thanks for that. Our next speaker is Sarah Sorsher, who's Deputy Director of Regulatory Affairs at Center for Science in the Public Interest. Center for Science in the Public Interest is one of the sponsors of this. So Sarah, you're our CSPI representative here. Tell us what CSPI has been doing. It's been leading this effort for a very, very long time. You've lobbied, you've sued, you're doing all kinds of things. What's going on with the whole warning label issue? Tell us.
Thank you. And thank you so much to our co-hosts at Hunter for this amazing event. I am enjoying hearing about all the innovative work that our colleagues are doing. So, much of the work that CSPI has done in this space has involved, improving the quality of information that consumers get about their food. And that means we're trying to stop misleading marketing. It also means we're fighting for basic transparency measures like calorie counts on menus and nutrition facts. And one of the big lessons that I've learned from my work at CSPI is that it's really a losing game going after misleading marketing claim by claim. The food industry is always one step ahead. You get them to stop marketing with cartoon characters, they switch to pictures of fruit. You go after them for energy balance, then it's share a Coke is the next thing. So it's an uphill battle. And one of the things that excites me about the icons work and the disclosures is that you get a chance to get ahead of the food industry. So we have launched this campaign now supporting cities and states that want to adopt disclosures for added sugar, especially on restaurant menus. And it's exciting. These policies are exciting because rather than playing whack-a-mole with the marketing, you're really forcing the industry to speak truth about their products from the start. And I'm also excited about these policies in particular because they are more accessible than some of the work that we've done in the past. A lot of the disclosures that CSPI has been the champion of have not cut deep enough when it comes to making sure that we're reaching every consumer. And just connecting to that point that Julio was making, nutrition facts is a policy that we fought for in the 80s. It was a terrific advance for, at the time, we thought, in terms of transparency. But I think we also deserve a bit of criticism for settling for too little, because that's a tool that forces consumers to bring something to the table in terms of their nutrition literacy, their motivation. So, with the icons now that we're talking about for menus, it's there in your face. You don't have to turn the package over, and you don't need to, do an equation in your head. You don't have to calculate your daily budget or understand, which nutrients are good or bad. It's just a simple, accessible educational tool. And, we know that these icons are going to appear on a ton of products. Aviva mentioned the sauces and dressings, but the biggest thing here is the drinks, right? Because we were talking about the 20-ounce standard soda, but if you look at restaurant menus, that's kind of the bare minimum. And a lot of restaurant sizes are much bigger than 20 ounces, and a lot of them that have these extreme excessive amounts of added sugar are being marketed as small, as extra small, as kid size. And we're getting ready to publish a survey hopefully later this week that looks at where that sugar icon is going to appear on fountain drinks. And most chains offer more than a day's worth of added sugars in every drink size except the kid size. So that includes the extra small, the value, the mini. And what these policies are really trying to do is put that pressure on restaurants to rethink what they have been normalizing as this extreme consumption that they've normalized, and speak the truth about what it is that they're actually selling to consumers.
Yeah, pretty impressive. Both New York City and San Francisco have been sued over their policies related to warnings for the sodium. And do they have sugar warnings in those cities? Can you say something about the legal challenges and how far you're willing to go with it and what you're up against?
Yeah, New York was sued for the sodium icons, and they were successful. Actually, the restaurant industry dropped that litigation. In San Francisco, they have more of a health warning on advertising, and that's really difficult terrain. It's also focused on soda. The soda industry is very litigious. And what we've seen over the years is that the food industry in general has weaponized industry in general has weaponized the First Amendment. So they've taken basic public health protections that are available in every other country, and they've been able to argue with some success that these are unconstitutional because they restrict the industry's ability to communicate about their products with consumers, maybe their interests with politicians as well. It comes into play there. And, this creates a certain risk for cities and states who want to pass these warnings. I think one of the big challenges, right, is that if you are successful in the lower court, you get appealed to the Supreme Court, you're running the risk that the conservative court will modify the test in some way that affects other jurisdictions. So it might be harder for other jurisdictions to pass soda warnings. It may impact other consumer products. It may impact tobacco. And so there is some concern here. I think it doesn't mean that we think states and localities should just roll over and give up when it comes to these important public health measures. It just means that I think there is reason to be cautious, and that certainly cities and localities that are considering these should certainly consult with First Amendment experts. I think, some of the policy, New York City icon, for example, is on fairly firm ground because it really looks at extreme overconsumption. The fact that most chains are offering more than a day's worth of added soda, and we're trying to single that out, it's a very uncontroversial thing. It's about communicating the truth about products, and that's something that the First Amendment was originally designed to protect, is this truthful communication, exchange of material information. So I think that there's definitely a path forward for these disclosures, but there is reason to be cautious and always talk to your lawyer when you're thinking about policy design.
Right.
As a lawyer, I'm required to say that.
Oh, it's great we have legal advice. Yes, I've always thought it kind of amazing that people think that the founding fathers intended the First Amendment to protect the right of food marketers to market their foods to kids. That has always seemed amazing to me. Let me ask a question or two to the whole panel because we have time for that. And I guess my question is a deeper one. I've always thought that I was the only person who ever looked at nutrition labels and calorie warnings on in restaurants, and that most people just don't go to restaurants for nutritional reasons. And I guess my question is, are these things used in the research that you've done? Are these things used? And if they're not used, how do we make them work? And you want to start on that, Julio? You want to go first on that one, if that's something you've thought about, or are students paying attention to calorie labels in restaurants? Would they pay attention to warning labels on sugar?
Yeah, yes. So I was really concerned. First of all, college students, well, based on my experience as a college student, I actually go to, well, before I studied nutrition, I actually go to the cafeteria and just grab a lunch or something, not even knowing the labels or anything. And that's what we usually do. And when it comes to added sugar, we usually tend to eat more sugar because, to be honest, I was addicted to sugar sometime because I don't know, it's just kind of feel like college students, we need sugar to feel better when it comes to courses and homework and assignments. So we usually go to the cafeteria to eat sugar. I mean, not all of us, but you get what I'm saying. So when I go to restaurant, I don't see like labels about added sugar, and I think it should be essential for everybody to have this information. And yeah, I think they could work just if we give the people the awareness that what it will cost to you, what it will cost to your body, because it's not only like just putting the labels and that's it, because it's gonna be the same. People are gonna like just and not even see it, not even pay attention and care about it. But if we give them awareness about what could happen if this product has added sugar, if this product have trans fat, saturated fat, what's gonna happen? So a way that we can like make things work, it will be like basically to use advertisement tool. Because to be honest, social media is a really good tool
Hmm.
because have you seen like the COVID-19 advertisement? I mean, people didn't even know what pandemic was before, I mean, the COVID-19. And the advertisement makes things more makes things easier for them to understand what they're supposed to do, because the COVID-19 advertisement, for example, say, you should wash your hands, you should keep 6 feet away, and people will do that because they saw it on the news, they saw it on the TV, they saw it on the social media, and I think that's a great opportunity for us to use this tool too, to advertise that added sugar can cause diabetes, obesity, can cause this, and there are a lot of different ways and interesting ways that we can promote nutrition awareness to the general public. And I think that's a great opportunity for us to take advantage of.
Great, thanks for that. So Aviva, you do the research. What are you finding?
Yeah, so in the case of calorie labels, we know that certain subgroups may be less likely to use calorie labels on menus. And it's especially people in low resource communities where calories are not the first thing that they care about when they're going into a restaurant, and that's okay. And I think that's true for a lot of people in the US. But I think it's important to understand label use by different populations so that we can figure out how best to encourage label use across everyone. And there's a lot of, for calorie labeling, there are messaging campaigns to help people learn about calorie labels and learn how to use them. And we're testing differential effects of added sugar warnings in our research, and we don't have those results yet. But again, I think if there are differential effects, it's important to direct education efforts and support to populations that need it most. And also, ultimately, if this policy does cause restaurant reformulation, which I think we could expect to happen, it would help everyone reduce their added sugar intake with no behavior change required, which is great. And as Julia was saying, another benefit of this policy is that it forces a broader conversation about added sugar reduction. People are talking about it, in the news. I think whenever this type of policy comes up, there are articles about it. It's shared on social media, and it's already encouraging discussion now with all of us. And I think that's fantastic.
Great, thank you. Sarah?
Yeah, I mean, to Aviva's point, it can be really hard to study reformulation, but I think that's really one of the most important things that this policy has the power to do, is to put that pressure on restaurants to rethink what they're offering. Right now, if you order a combo meal in many places, you get an upcharge to get water, right? If you want to get a bottled water, that's more money. And imagine if you could design a policy so that they could get that icon off their meal if water was the default, right? If another 0-calorie beverage was the default. Imagine if you could have a policy that was actually getting them to serve reasonable sizes so that when you do order a full calorie soda, that it's not, taking up your added sugar budget for 2 days, right? So I think, that's a really important thing that these policies that can do that can be hard to study. I know that Philly's looking now at the reformulation that was done for its sodium warnings. And they've talked to a few restaurants who've actually rethought their menus based on those warnings. So I think that's a really important piece of it. The studies that we've seen so far that look at consumer behavior haven't seen a big discrepancy by demographic the way that we do see with calorie counts. And I think part of that is that warnings do tend to be more accessible for folks.
Oh, good. Thanks for that. Restaurants, this is a really tough time for the restaurant industry. And the COVID-19 has really hit them very, very hard. Is this the right time to be thinking about this? We're hoping for a post-COVID future, but I'm interested in your thoughts on that, and also on what the social justice issues are here. And I think we have time for one more round on this, so you each get a couple of minutes to talk about this. Julio, do you want to start either on whether we're being mean to restaurants or what the social justice issues are here?
I mean, I think I'm in the middle with the question because it could be kind of stressful for restaurants owners and small businesses because of this pandemic. They have lost a lot of their support and income and everything. So I think that yes and no, because also people are like buying a lot for like takeout and delivery more than ever. So we need to like prevent added sugar and these obesity and illnesses to keep growing and prevent them. But that's why I'm in the middle, because it will affect the restaurants owners and it will also benefit the people itself.
Yeah, being in the middle is not a bad place to be, although it's not very comfortable sometimes, but thank you for that. Aviva, you want to comment on, how, and just generally the politics of this?
Yeah, I think it's important to remember that this kind of policy only applies to large chain restaurants. So I know that it's been a tough time for restaurants, but these chains typically have leeway with their sales. So they have a lot of money still that they can use to enact this type of policy. And research that I think CSPI has actually published a report looking at the costs of menu labeling, and it's actually not that much for these large chain restaurants that already have a ton of other costs. And I also want to just emphasize that, yes, this has been a tough time for restaurants, but it's also been a really tough time for humans. And I think we need to always just recenter from a public health focus. Yes, restaurants are losing money, but we have been inside in quarantine. People are moving less, they're eating more. Mental health has taken a toll. And I think now is a great time to help consumers understand when they go back to restaurants and when they're ordering from restaurants, what is in the food they're eating. And they may be trying to make healthier choices. And I think added sugar warnings can really help people understand how much sugar is in their food, and it can help them cut sugar in their diet.
Good point. Thanks for that. So Sarah, you want to get the last word here?
Yeah, I mean, I think the pandemic has really created this profound moment, this shift in the way that we live our lives. And we're coming back now into the food environments that we've sort of taken a break from, right? And restaurants is one of those examples. And I think this is an opportunity to look around and see what are the things that we've assumed as normal before. How can we recreate those environments in a way that helps ensure that our community is coming back stronger and healthier than it was before the pandemic? We know that, the sort of, we had a pre-existing pandemic going on of diet-related disease, right? Mm-hmm. And that COVID was layered on top of that, but, we had worse health outcomes because of the way that we were prepared for that pandemic. And I think that, policies like this one that help us build stronger food environments, healthier food environments, are going to be make communities better prepared for the next pandemic. Really, I think that that's a journey that we have to take together. I don't think we should be reluctant to do that because we've experienced this profound change already.
Well, thanks for that. And thank you to this panel. I want to thank everybody who spoke today for packing so much information into such a short time. I really learned a lot from this, and I'm very grateful to all of you. So thanks for that. Charles, over to you.
Thank you very much. And I want to thank all of our engaging panelists and the Center for Science and the Public Interest for being a wonderful collaborator and partner. And certainly Dr. Marion Nessel for taking this big, huge load and making it into something, wonderful and coordinated. And thanks to Alexina Cather, Deputy Director of the Hunter College New York City Food Policy Center, for making this happen behind the scenes. And all of you out there making a difference every day in the food world, which is so critical. Listening to all these speakers and thinking about how we can make a better impact in our food system, which again is so critical. So thank you for that. Thank you for all of you out there listening, and thank you to everyone at the New York City Food Policy Center. Go to nycfoodpolicy.org and sign up for our weekly news digest, and have a wonderful week. And please, stay strong and help yourself and help others. Take care.